everyone. Dr. John Bartemus here today to discuss an important topic if you have children. And that topic is the topic of ADHD as well as ADD, which is an outdated term and actually stands for the inattentive portion of ADHD patients. Now, this topic is important to me because I have children, and this year I have a kindergartner for the first time. And my kindergartner, if the school had their way, would be labeled as an ADHD student and be put on some sort of medication. And we'll get back to her in a moment. But what I want to talk about first is ADHD and its classification and diagnosis. ADHD is classified in the DSM-V. The diagnostic criteria is classified as a child being less than 12 years old, a child having the symptoms of being inattentive and or hyperactive and impulsive, as well as other symptoms of up to 6 or more symptoms for 6 or more months. Okay. This also includes the symptoms have to be happening in 2 or more settings, so they must be exhibiting the ADHD symptoms, say, at school and at home, at least those 2, and the symptoms must be interfering with their ability to function and develop normally. And also, lastly, the interesting criteria is their symptoms can't be better explained by some other psychiatric or cognitive disorder. So basically, there's no one out there saying, or there's very few people out there saying, there are people out there saying, but there's very few doctors out there saying, what if this is just normal for a kid? What if this kid is maybe a little behind the other kids in their class? What if this kid is a little more right-brained for a little longer than the other kids in this class? What if this kid requires more recess, more gym, more playtime before heading into the classroom and sitting down? Because after all of our children are monkeys in a cage, especially in our school system in America, where they're removing gym class and removing recess and removing all forms of activity and saying, no, sit still and focus and do your work. Whereas, they're monkeys, and monkeys need to move, and brains need activation, and activation is movement. So if our systems really want our kids to excel in school, they would implement recess, multiple recesses a day. They'd implement gym class, multiple gym classes a day. They'd implement play, period. And we would see all of our kids improve across the board scholastically. Now, those criteria are the DSM-V criteria for diagnosing ADHD. What I have observed in my clinical practice over the years is that many children who have ADHD and are medicated for it have not been diagnosed by these criteria, but were diagnosed by a non-health professional like their teacher. And that is obviously poor medicine, because it's not medicine at all, but it's also dangerous for these children because due to the inconvenience that the child is causing the teacher, they're put on a drug so that they fall in line better in class due to the diagnosis by a non-health professional, their teacher. For example, my daughter is in kindergarten, and according to her teacher, she is not focusing and concentrating as well as she should at specific times. And I can see that because my daughter is one that kind of has her head in the clouds. She loves to go outside and play make-believe and have her, pretend she's in Jungle Book or Beauty and the Beast or whatever and play on her own and be fine. But that's a normal kid. In the classroom, I can read you an email, but in the classroom at ParentTeacher Conferences, the teacher has said, when we're in reading time, she doesn't pay attention, and after that she can't answer the questions relevant to the reading, etc., etc. And so we recommend you take her to your pediatrician and have her assessed. And so reading between the lines there, that's basically saying, I believe your child has ADHD, take her to the pediatrician to be assessed or diagnosed or given some sort of medication to make them focus better. So that was at an earlier parent-teacher conference, and we received an email March 1st from our teacher that said, "I wanted to write to catch up with you about what we discussed at our previous meeting. We spoke about taking your daughter to the pediatrician about her focus. I wanted to see how that went and just follow up with you about it. We are still seeing a lack of focus within the classroom. If she is focused on something, it's usually not what we are doing as a class. I check on her many times during desk work to make sure she is staying on task. Our read-alouds for science social studies are very difficult for her. She struggles to recall information from the lesson and answer the comprehension questions. We've tried moving her spot on the carpet. I say her name throughout the lesson to try to help her stay with me. She still has times where she tells me things are hard. Our curriculum is picking up quite a bit." So again, previous to that email on March 1st, they had recommended going to the pediatrician. I'm not taking my child to the pediatrician to get on the drug so she can focus more in school. This followed up, "Hey, how's she doing? We're still seeing it." So I said, okay, I'm going to do what I know as a true health professional, as a doctor with functional medicine and functional neurology training, and assess my daughter and deal with it naturally. And so my wife had responded to the teacher and said, "We're going to do that, and John will send you an email telling you what we're going to do." I never sent the email because I don't want her to know what we're doing, because I just want to do it and have her go to school and see if what we're doing is working, and that would be confirmed by the teacher by her own, under her own power, coming back to us and saying she's seen improvement. And so I assessed her and did some functional neurology rehab with her, and did some functional medicine support for certain neurotransmitters, and this is what we got back. So that was March 1st, where they checked in to see if we took her to the pediatrician. We didn't. On March 29th, she sends an email and says, "You are welcome to keep the report card," because the report card came home recently, a couple days ago, with my daughter, and on the report card it says, "Natalie is becoming more self-reliant during independent work. She is working on expressing her ideas more clearly and listening and following directions. The past few weeks we've seen some strong gains in comprehension during read-alouds and carpet time. We are proud of her accomplishments." So she followed that up with an email and said, "We are very pleased with what we've been seeing in class. She has been participating more in class, and she seems to be able to focus more lately. I know you said John had a plan since the last time we spoke, but I didn't hear anything. I'm not sure if you started doing something differently with her, but something seems to have changed with her." So, like I said, I never reached out to tell her what I was going to do, because proof of concept would be do what I was going to do and let them tell us it's working, and that's what you've seen right there. So before you run off and get your child diagnosed with a psychiatric disorder that will be on their permanent health record for the rest of their life, and that will put them on a medication that they likely don't need and has side effects that could damage them, get them assessed by someone who looks at them as what they are: a monkey in a cage that is developing at their own rate, that may or may not fit the developmental rate expected of every kid, because every kid isn't the average, every kid is an individual, and individuals have the right to develop at different rates. And that clinician also needs to assess their lifestyle and their nutrition and their neurology. And that's what I did with my daughter. I dressed her by functional neurology, so training certain areas of the brain to strengthen the brain, and then we provided functional medicine care, so nutrition to support focus and attention. And focus and attention is part of the frontal lobe, or the forebrain, and the neurotransmitters involved are catecholamines, like your epinephrine, norepinephrine, and dopamine. So being able to support those pathways and then activate the brain to create plasticity in those areas has led right at 4 weeks, basically, probably 3 weeks, because it was a week till I started it from that email. In 3 weeks we've changed her enough that the teachers are sending home glowing reports. So I just want to encourage you to have your child checked out holistically and from a functional perspective before taking them to the pediatrician and having them put on a medication due to what may be just an inconvenience to the teacher in a classroom full of children who are all developing at a different rate. And I want to say that the teacher, I don't fault the teacher, that I actually think highly of her teacher and think she does a great job, and I'm thankful for the concessions they made to try and get her to get on the level that they expected her, wanted her to be at. But so they're well-meaning teachers, and their classes are overfilled, but that still shouldn't allow a child to be misdiagnosed because of those inconveniences. So do your best for your child, have them checked out. I encourage you to reach out to a functional medicine practitioner, especially one with functional neurology experience as well. If you want to learn more about dopamine and catecholamines and those pathways, I've done a YouTube video entitled Dopamine Deficiency. Search that out and check that out. And as always, continue to watch my YouTube, my podcast at Accelerate Health with Dr. John Bartemus on iTunes, and I look forward to seeing you again soon. Have a great day.